The next step is crown placement. Okay, now we can place a crown. It's not very critical to place a crown at this step. Don't bother about putting your crown perfectly as much as possible. Just place it in an acceptable way and we can adjust it later. So the software asked me to place a mesial contact point on 2.7. So this is the mesial of 2.7. I can place a point here and another point on the distal of 2.7. Okay, it's not perfectly placed. I told you don't bother. It's okay. We'll adjust the placement in the next step. So you can choose from different libraries, of course. I will stick with the generic. So it's okay. I can place the crown and I can click next. Of course, if you have a free in saddle, I will show you later what to do. If you don't have contact points, I will tell you what to do. Next. Now, this is the step where you adjust your crown. Okay, let's see our icons. You can move here, move freely. You can rotate if you click rotate, and you can scale, you can make it big or small. If you click scale, you can undo. If you click move here, you can, this is move freely. Here it just moves in mesiodistal direction. You cannot move it backlingual. It restricts the movement. Here it only moves backlingual. If you try to move it mesiodistal, you are not able to. Here you can move it occlusal only. You can move it just occlusal. You cannot move it mesiodistal, neither backlingual. And so on. Here you can move just mesiodistal, backlingual, but not occlusal. You cannot move it occlusal. Same for rotate. You can rotate in a backlingual direction only without rotating mesiodistal. Here you can rotate only mesiodistal without backlingual, and so on. Scale, also you can scale in different directions. For example, here you can only scale backlingual, not mesiodistal, just backlingual. And if you click the mesiodistal scaling, you can only scale mesiodistal. So if you choose move freely or scale freely or rotate freely, this means that you are doing free movement. You are free to do whatever you like. Usually, if you want to do the fine tuning, you can restrict only to a certain area. You can just restrict to a certain area for movement, for just fine tuning. Okay, let's see the shortcuts. It's better to use shortcuts than just clicking move, rotate, and scale. It's much easier. If you press Control, you can rotate in any direction. If you press Shift, you can scale the whole tooth. Now let's see the shortcuts. Shortcuts are way better from using the move, scale, and rotate icons. Using the left click, let's just adjust it. Using the left click, you can move freely. Okay, I'm just pressing the left click and moving my mouse. So this is the way to move your tooth. If you click Control or press the Control button and use the left click, you can adjust your rotation. And if you want to scale, you can press Shift and move the mouse. This way you are scaling the whole tooth in every direction. If you want to scale in a specific direction, for example, backlingual only mesiodistal or diagonal, you press the Shift and Control together and you move with your left click. So again, left click moves, left click with Control rotates, left click with Shift scales, and Control and Shift with left click scales in a specific direction. So let's go to the placement. First of all, I have to make sure I'm looking from the correct view. I have 3 views to look from: top view, side view, and front view. If you look from the top view here, you have to imagine an imaginary curve passing through the foci of the teeth. So you place your central foci aligned with the central foci of the other teeth. Of course, they should be placed if the teeth are not rotated, if they are well aligned. I shall scale it a little bit. It's too big, and rotate it. Okay, maybe scale it bacolingual, and we can adjust the contacts later during restoring. This is from top view. Always look from the other view. This is from the side view to adjust the occlusal level, and this is from front view. I can see that it's protruding a little bit, so I can put it like that. So always my advice is to look from different angles. Don't just use one angle, don't use two angles. Always look for the third angle that is missing. Okay, so now I have placed my tooth aligned in for prosthetic driven implant planning. As you can see here, if you want to do some fine adjustments, and this is very important, you can, let me tell you a clinical tip. If you're doing an immediate load, it's better not to make the cusp steep. It's better to make a narrow occlusal table, to make a flat cusps and so on. So if I'm doing immediate loading and I'm going to fabricate this crown in the future, maybe I need to make the cusps less steeper, because I want to minimize the forces during immediate load. Of course, immediate temporization. Immediate loading means immediate temporization, and you can increase the cusp tips in case you are going to do delayed loading, so you can increase the steepness of the cusp tips. I want to make them flat if I'm going to do an immediate load. These icons are for the occlusal contacts and adjustments. This is a surgical guide. We don't have an opposing. We are not going to do an immediate load. We are not going to fabricate an immediate load restoration. So we are just going to look at the crown for just guiding purposes, not for immediate loading. We don't need those icons in this tutorial for the moment. Chain mode is mainly for long span areas. We are going to talk about it in maybe another case that is more complex. So we have to go to simple, and now we can see our tooth placement. If you want to move the whole intraoral scan, you can just keep pressing on the right and left click and just move. Okay, if you want to rotate, it's a right click and move, and you can see from different angles rotation. If you want to pan, just click right and left. If you want to change or scroll through the cuts, use the wheel mouse to see. And also look at the orientation here. You can change into panoramic mode or change into axial, coronal, sagittal mode. Of course, in dental, we use the panoramic mode to always have the cut perpendicular on the alveolar ridge. So this is the tooth placement, and let's proceed to the next step.